got two more presentations. Maybe just wait a minute for some stragglers. And then questions on those two presentations, then we can shift to the general discussion. So if you've got general comments, we can have them and maybe pick up any pressing, urgent ones on the physiology stuff that hasn't been addressed. And then we'll split that last half hour between our kind of key messages and then what set of things you might want from the network and some specific activities. I think we should start.
Okay, good afternoon, everyone. Good afternoon, yes, good afternoon. Today, I'm going to talk about personal protective measures among the Hong Kong community during a heat wave in 2017. This study is to understand the community's response to hot temperature, hot weather in terms of the risk perception to high temperatures, awareness of heat warning issue, personal protective behavior undertook, and the self-report health outcomes. So this is a telephone survey using landline telephones. So this is a household-based study. Our sample was a follow-up sample from our previous cold wave survey done in 2016, and the sample was matched to the census data in terms of gender and residential district, but our sample was a bit older than the population because of the last triple up. And our samples are all 15 years old above Cantonese speaking. And the survey was done the beginning of August, just 2 weeks after the survey, after the heat wave, and our sample size was 436. So the heat wave was the heat wave we studied was start from 25th to 30th of July 2017, and the average daily mean temperature was over 30.2 degrees Celsius for consecutive 7 days. I know this is not a hot temperature for the tropical area, but in Hong Kong, because we are talking about the mean average temperature measured in the city center, so it usually will be lower than those experienced in the other parts in the city. So when the city center average temperature reached 30.2 degrees Celsius, it means it's really hot in the city. Thank you. In particular, we also observe a relatively low wind speed and very high air pollutants level in those days. So we guess there would be a serious health impact on the community. So we decided to start the survey very quickly, just in 2 weeks. So the first question we study is the risk perception to high temperature. In the survey, we asked our respondents whether they agree with this statement, whether they think high temperature has adverse effect on their health. And about 54.7% of them, about half of them think yes, heat have adverse health impact on their health. But when we look into age group, we found that among the older age group, those older than 70 years old, the rate agree with this statement was much higher than the younger age group. So it's a very good sign, because the elderly seems to be aware of their high risk compared to the younger age group, which for the younger age group, the people, only half of them think themselves under high risk in high temperature, but for the elderly, about 75% of them agree that they may have high risk. But when we look into diabetics group, just as our colleagues have introduced in the last presentation, diabetes people, we have a lower sensitivity to temperature, and they may have poorer thermoregulation ability. But in our study, although we have a very small sample size here, but we also see that this group of people do not have a high rate in agreeing this statement. So this indicates that maybe in our city, in our locality, some people who are more vulnerable because of their long-term medical conditions, they may be have higher risk under high temperature, but they did not aware it. And the second question is the awareness of the heat warning issued by the Hong Kong Observatory, and we found that 87% of our respondents were aware of the warning issued by the Hong Kong Observatory, and these people were more likely to avoid long-term exposure to sun, more likely to put on sunscreen, and more likely to ask about old people and those with chronic disease. And this is also a good sign, because it seems the the warning can reach our community, the most of our community, and the warning really can have some impact on human behavior. So, personal protective behavior, these are the questions we asked in our survey. We found that in our locality, the protective measure that done by most of the people is drinking more water, which 97.5% of our community said they have drank more water during that particular heat wave. About 90% of them had used air conditioning because Hong Kong is an air conditioning city, and ensure indoor ventilation and avoid long-term exposure to sun also reached about 90%. And about 70 to 80% of our communities, our sample has taken enough rest when they perform outdoor activities, went to cooler place when they're feeling unwell, and wear suitable clothes. But we observe a particularly lower rate in putting on sunscreen, which only about 37.2% of them have done that. And also we found that males were less likely to do some of this behavior, like avoiding the sun and putting on sunscreen when compared to females. We thought this is maybe related to the skin problem that women always worry about. So, and we also found that people with lower education level were less likely to use air conditionings. So the fourth is the final one is the health outcomes. So we also asked whether our respondents have experienced any health symptoms during that particular heat wave. And we see that in the 25 to 69 years old age group, about 35% of them report at least one symptoms, and a little bit higher in the older age group, in above 70 years old, about 45%, but the highest was found in the youngest age group, which was all under 24. We think that because these people are all students, and most of them are students, so they may more chance to expose to outdoor temperature and the sunshine because of the physical activities. And okay. So those are our results, and we try to compare our results with study from other places in the world and from other continents, from the US, Australia, and the UK. And in terms of the, we identify some common patterns in terms of the four areas we study. First is the risk perception. The elderly study found that half of their respondents think that agree the heat is dangerous or will affect their health. So it's very close, very similar to what we found in Hong Kong in last year. And when we look into the subgroup older than 65 years old, about 70% of them agree with this statement. And those in the US, about 65% agree with this statement. So I think we didn't do any statistical result to compare it, but it's obviously quite comparable in different countries. And the second part is the awareness of the warning. Our study found 87% of people know about the warning, but in the US, we also found that 83 to 92% of the elderly, anyway, the elderly has aware of this warning, so it's also comparable. The third one is the personal protective behavior, because the four study have looked into different behavior, and the way they measure the behavior were different. So I just picked one behavior that have been assessed in all four studies is drinking more water or cold fluid that have been mentioned in the previous study earlier this morning. And we found very similar result between UK and Australia. They both report 83% of their respondents have drank more water or cold fluid during hot days. And the rate was lower in the US, which only half of them has done that. But in Hong Kong, is 97.5%, almost everyone have done this protective measures. And when compared to other studies, I think that all these three studies have found that males and people with lower education were less likely to do the protective measures, and probably lower income also is an associating factor. And in the UK and the Hong Kong study, we both found that the younger people, the younger age group, were more likely to report at least one health symptoms during hot days or and the heat wave.
1 minute.
Yeah, sure. So, to summarize, we found that the risk perception identified in this study was quite comparable with other places in the world, which about half of us do agree heat is affect our health, and some of the vulnerable group, like the diabetes group, may have underestimated their risk. And the second is the heat warning. We found that they can reach most of our community, which is a good news. And the final one is our community seems to, most of them have adopted at least one heat protective measures, and the warning seems to have some association with the uptake rates. So main limitation, our study is a landline telephone survey, so we could not reach people with our landline. And we do not have information about the activities done by the respondent and the environmental condition they experience, so we could not judge the appropriateness of the and the effectiveness of the behavior taken. And we also did not have the baseline health information, so we cannot say that all the symptoms are related to high temperature. And the final slide, we have a few points to suggest for the heat planning. The first is to raise awareness and the perception accuracy, which we think is very important for the vulnerable group, especially for people who have long-term health condition. We have to make sure they know they are under higher risk, so they will take up some the corresponding health protective measures. And we also have to raise the awareness among the young people, because they are the group that potentially have high exposures. And the final point is we should understand the barriers for people who did not or less likely to do protective measures, such as the males group, low education level, and probably the low income group. That's what I want to share today. Thank you.
Our final speaker from the US. I think mine's a PDF, so I may have to use the arrows. Okay, thank you. I'm Ashley Ward, and I was asked to talk with you today about the community engagement work we've been doing in the Carolinas. I am part of the NOAA RISA network. RISA stands for Regional Integrated Sciences and Assessments. This is a program in the Climate Program Office of NOAA. There are 11 research teams that you see here on the map located throughout the U.S. Our mission is to work with communities to help build adaptive capacity, support decision-making, build resilience against climate extremes. And so we are all regionally assigned, and I work in the Carolinas, which is North and South Carolina on the eastern coast of the U.S. Each RISA has a wide variety of functions based on the needs of their region. So for the Carolinas RISA, our focus areas are water, coastal climate, climate and public health, and communications and outreach. And I fall in these last two categories of the public health and communications and outreach for our RISA. So I'm going to give examples today and talk with you about the process of engagement and evaluation based around a series of engagements on heat illness that took place in North Carolina. What you see here is a map that shows heat-related illness rates per 100,000 at the zip code level for the U.S. For North Carolina. Sorry. And so you can see there's most definitely a geography to heat illness in North Carolina, concentrated very much so on the coastal plain, particularly in this region here, the Sandhills, which is where most of our engagements were concentrated. Now, unlike what most people experience with heat-related illness, in North Carolina, this is our urban center in North Carolina. And so as you can see, heat illness is not concentrated in urban spaces in North Carolina. In fact, heat illness rates in rural areas are about 8 to 10 times greater than they are in urban areas in North Carolina. So what this means is that our engagements take place not only among vulnerable people, right, but also in vulnerable communities that are isolated from the resources that urban communities typically have. And so that's a really important component of part of the engagement strategy for our RISA. With this project, we worked with a variety of partners. The Southeastern Regional Climate Center is one of the 9 regional climate centers, also another RISA program. North Carolina CDC BRACE program. BRACE stands for Building Resilience Against Climate Extremes. There are, I forget how many, maybe 7 BRACE programs in the U.S. We were fortunate enough to have one in North Carolina. We also work with county level health departments, and then a heat health working group, which was established and maintained by our CDC BRACE partnership. And this working group consisted of very broad group of individuals, from high school athletic directors to agricultural extension agents, migrant worker representatives. It really was a very broad group of folks, which was wonderful too. We engaged in a variety of different ways with the community, a webinar, some large engagements. This will be important later in the talk, some small engagements. And then this final engagement was an engagement that was dedicated to an evaluation. And throughout this series of engagements, we evaluated via survey and focus groups, but in that final engagement, we conducted eye tracking evaluation and web analytics. And I don't have time today to get into the eye tracking and web analytics, but I'm happy to talk with any of you who are interested in that. And it's really awesome and cool. So if you work with digital web-based products, I highly recommend you consider looking into it. It's a really valuable part of an evaluation. This was one of my favorite quotes about community engagement. Basically, asking people to engage in science just to engage doesn't really do anything. It doesn't actually lead to more effective, efficient, or responsive science. And this is a very true statement in my experience, right? So I think we have to think about, what does engagement mean? If you're thinking about engagement in terms of having community members just collect data for you, it's not really participatory engagement, right? It is important that we empower communities so that they can be an integral part of the process. And to do that successfully, it requires that we integrate this in our research strategy from the very beginning. It's a very organic and bottom-up strategy to research. This can be challenging because that's not really how we're trained as scientists, right? So I'll talk about that again in a moment. Okay, so there's been a lot written already about the benefits of stakeholder engagement. Community-based participatory research gives us a lot of great information out of public health as well about when we engage with communities, that means they're more likely to believe the science, to use it. And it also contributes to this idea of sustainability. And I want to define that a bit because I know that's a term that's used in a lot of different contexts. And for me, sustainability refers to the fact that when we leave the community, the benefit of that partnership continues after we're gone. It means that I don't have to be present there in order for communities to continue to put in place the practices that we've established through that community engagement practice. And I think this is critical because we really want to make a difference in communities to have sustained support for decision making and build resilience. It requires that we consider what happens when we leave that partnership. Okay, so this is a quick little example of some of the benefits of community engagement. So one of the tools that we developed is a web-based tool that allows communities to be able to use forecasting and see, based on a 5-day out forecast, days of increased risk for heat illness. I'm happy to talk with any of you about this tool later, but I want to demonstrate a little bit of the benefit of the engagements. Now, when I entered this position, I entered after this tool had already begun and some of the initial engagements had already taken place. And so this is the second version of the tool. And you can see there are a few notable, the menu looks very different than what you see on your right. There's also a lot of information here. I know it's hard for you to read, but this basically says rural model using daily maximum heat index for Bladen County brownfield. Okay, and there's a lot of information here based on the weather station from which the data was taken. A lot of different model options here in this graph button. Now, we started doing those engagements that I was telling you about, and I realized that not a single person that I engaged with, not one, automatically understood how to run the model. First of all, this is a red button. Intuitively, red means stop, don't push it. Okay, so they don't push it. And it also says graph. And so if you've never used this before, you don't understand the output is a graph. So why would you hit a button that says graph? And so, by doing those small engagements, and I'll talk a little bit about those in a minute, just watching people use the tool is really important. So what you see here is the final version. Very much slimmed down. All of the data that they had is collapsed into these menus that they can pop up. It says go. It's not red. Okay, challenges.
Those rural, low-resource communities can provide some really serious challenges. Where do they have internet access, meeting space? Do they have travel dollars to go from one county to the other? All of these things. This is why those different types of engagements are important. We started out, we shared the science with the webinar. We had some big engagements where people had to cross county boundaries to come. But we had students and other folks, myself included, who drove to counties, sat in people's offices. They had their computers up. There were 2 or 3 people there. We watched them do it. They felt really comfortable telling us what they didn't like in that circumstance or voicing their opinion about particular capacity issues they had in their county. We also have to understand that when we're talking to the health director in these small, low-resource counties, this health director could have 5 different roles they play. They could be thinking about chronic illness like diabetes or opioid overdoses in their county. So sometimes it's hard to get heat on the agenda, which we've already talked about here. But this is a really important point. We have to meet communities where they are. And sometimes that means they may not know the stats. They may not understand all of the epidemiological methods that we use. That is where they are. And so I think it's counterproductive to expect something that's unrealistic, giving some of these low resource communities and what they have. They're trying. They work really hard. Okay, so what are some of the lessons learned? The depth of those partnerships that I showed you. This is really critical because it is great to have federal and state reps sit in a room and hear the community folks talk about how they use their tools or don't use them. It really gives them some insight. Just invite them to come. They will show up. The community also likes it because it means that their input is valued. This is probably one of my biggest lessons learned from my work. We talk about vulnerability. We talk about vulnerable people and vulnerable communities. They do not see themselves that way. They see themselves as assets, and they are assets to your work. They've lived in that community forever. They know exactly where the flash flood happens when it rains a lot. They know who's vulnerable to heat in their community. They see themselves as an important contributing partner to your research. And so I think it's very important that we not strip them of their agency and we not think of them necessarily only in terms of vulnerability. They also provide great opportunities to identify research gaps. A quick example, as we were engaging with people, who is most vulnerable to heat index in your county, people kept saying, pregnant women, pregnant women, pregnant women. We had not expected that, so we did a little bit of work, and as a matter of fact, there's not a single article written about the impact of heat on pregnant women in the southeastern part of the U.S. We've done the research. There's actually significant results here. This is all that was community-driven. That came from them back. This variety of types of engagement, like I just told you, this is how we address the community capacity issues and support the idea of sustainability. And then finally, integrated evaluation. This is an iterative process. This is how you understand if what you're doing is going to work and be sustainable, right? So you have to develop interdisciplinary methods. We have great methods for looking at the process, right? How do we engage with people? Community-based participatory research gives us lots of ways to evaluate this process. If we're developing web-based tools, how do you evaluate that? That doesn't come out of that same field of literature. We have to find where that is, the eye tracking, the web analytics, adopt those interdisciplinary ways. It matters what you leave behind. So we have to make sure that it's usable and functional for the community members. And then the impact. Impact's really tricky. We do have a lot of information on impact evaluation from climate services, but also from other disciplines. This is probably one of the most challenging things because people want the results of the impact on a time scale that's different than it's actually generated. It takes a long time to realize some of the impacts. So to think creatively about different ways in which we can communicate that, especially in our particular environment in the U.S. where they want everything quantified, an economic kind of evaluation. What kind of economic impact are you making? They're thinking about it in that terms. The community's not thinking about it in that term. So, I think these are some really important tips to think about as you're engaging with communities and thinking about sort of reversing. Not that I'm not advocating for not doing hypothesis-driven research, right? But what I am saying is maybe create a bit of space for a different type of scenario where it comes from a different direction back forward.
We'll just take 2 questions very quickly. Any questions? Yes.
Just a quick question for Holly. Can you just clarify, so in your guidance, are you suggesting that, or are you telling people that sunscreen is protective against the heat?
actually in our study, we did not say anything, provide any information. We just did a telephone survey, ask what you have done, and it's just based on some information we gather from different maybe websites from the government who suggest what to do. So we put that all in a list in survey, and then we ask people whether you have done this during that particular heat wave.
Okay, so maybe I'll just quickly clarify. So is anybody saying that sunscreen is protective against the heat?
So it should not be related to heat, but
Okay.
sun,
Okay.
yeah.
Thank you. Yeah. Excellent.
If I can direct a question to Ashley, let's appreciate the insights from the Carolinas. And I'm just thinking about the circumstances in Hong Kong or China or East Asia, in thinking of this kind of a Confucius society. I'm not trying to get to this kind of a transferability or societal differences, but do you see there are emerging opportunities for community, let's say grassroots kind of approach, taking advantage of these emerging technologies, social media, for instance, web-based tools, mobile apps? Is there kind of a way that you think other society can leapfrog in certain ways and then kind of strengthen that capacity? I think it's truly essential, not the purely from the top-down perspective. Thank you.
I do agree with you. I think that, in my experience, community stakeholders, they are very aware of where, not only where their issues exist in their community, but most frequently they have the idea about how to address those issues. What they lack is the capacity to do so. And so one of the roles of the RISA, and I think one of the roles of research generally, would be to help leverage resources that universities and other agencies have in order to be able to do some of the things that you're talking about there too. I definitely think that, however, we have to be careful about how that happens because, we've definitely seen in the mobile apps, for example, for health applications, how they're, lots of those applications are developed, very few of them are used consistently and accurately, and that's why I advocated so strongly for something like the eye tracking. Eye tracking doesn't just tell us where their eyes go on the page. They actually have to answer questions about how they interpret the output. And so it helps us understand comprehension of also what's happening. And so I think, yes, the question is yes, the introduction of technologies can definitely help communities address some of these issues, and I think that can be across, different places and scales. But at the same time, I think we have to be conscientious of how we develop those technologies and apply them and make sure that we're doing that iterative evaluation process so that we don't just develop more, noise.
Yes. Okay. Any final? All right. Just.
Thank you both. First, beside telling people to use sunscreen during hot episodes, which is fairly common in government websites, they also tell people not to drink beer, not to use fans. So all that ties everything together. But my question is about relevance. So if people have just heard a heat warning, I think they're much more likely to answer that they take it into account. Did you ask people, had they heard a heat warning, and if so, when? And did you relate that to their answers about the importance that they gave that warning? And second, have you considered doing a survey immediately after a heat warning and asking, did you hear the heat warning, and if so, what did you do? Which I think is also useful information.
Yes, we did a survey 2 weeks after the heat wave. Yeah, and then we asked whether they know about the warning issued during that particular period and what they have done. The list, so we asked each question separately whether they have done that behavior within that particular period. And you talk about whether we have the government who tell people not to drink beer or something like that. I don't think I saw that in our official website for the government. They all show very general guidelines. So just ask you to wear suitable gloves to cover your to cover your skin and go to a cooler place or shelter if you were staying long under the sun, something like that. But they they don't say anything very specific.
Maybe a North American phenomenon.
No, the British one says don't drink alcohol. So it's not just beer, it's also wine. Okay, thank you very much. So, if we could just have a general discussion now about our key messages. This isn't comprehensive, I've just put up a few, and then obviously we've just had three, I think, from the last session, which relate to the importance of public engagement, the importance of messaging, again, which is around not labelling people as vulnerable, identifying people, individuals or communities as vulnerable. And then the third one, which actually summarised very well about the evaluation of technology. This is very tempting for people to go for these technology apps, but you know, there's no point putting in ineffective interventions. So, over to you, general comments, or if there's anything on there people don't agree with. And no, there's kind of key advances. So what do we know now? What any particular messages we want to say about what the new findings? I've made these operational gaps, so and evidence gaps, of which there's probably a whole lot more, and I haven't captured them all. Okay. So we have a note taker, so I'm not going to try and update this at the same time. It's just too difficult.
All right, my name is David from United Nations University in Malaysia. And there are a couple, two things I was, want to bring up. First is we've been talking a little bit here about reducing ACUs. And I think there is a need to try to figure out how this ACUs versus health impacts. What kind of messaging are we going to give? Broadly, if we're going to change that, and we need evidence both in terms of heat waves, but also in terms of daily use. In the tropics, ACUs is driven very much by being able to sleep at night, and what are the health impacts there, what are the heat impacts there. The second thing is in our discussion of vulnerable groups so far, I don't think I've heard anything brought up about migrant workers. And we know that these groups work predominantly outdoors in construction. They have little control over their working conditions, and when they suffer health impacts, they have very little recourse to health services. In Malaysia, we've got about 400,000 Nepalese workers, for example. And these are young men, mostly between the ages of 20 and 40. And in the past year, there's been one death per 1,000. And most of these are attributed to cardiovascular conditions. And obviously it's not just heat, but heat is definitely a strong component in their working conditions.
I think those are both excellent points. Does anybody want to add those comments?
Just want to follow up on excuse me, on the comments about air conditioning. I think it's incredibly important to try to understand how air conditioning actually perpetuates the problem. So in terms of the way in which we perceive an environment from a thermal comfort point of view, which would be the predominant driver for using air conditioning, is if we are cocooning ourselves away from the environmental conditions and then we're used to this colder air temperatures, the ambient temperatures that we perceive to be comfortable become cooler. So therefore we continue to use air conditioning because we're not allowing our body to psychologically but also physiologically adapt to the hot environment. The example I always give to students is I don't get I have big muscles, but you don't get big muscles by having my office next door to a gym. You have to go to the gym and actually expose yourself to the stimulus, lift the weights to get that adaptation. And it's the same thing with heat adaptation, is that people don't acclimatise if they're cocooned off in their air conditioned environment. And that has big knock-on effects in terms of energy use.
new comments or on the? But I think that, well, bearing in mind the air conditioning problem, it relates to both kind of behaviour, so there's behaviour change and intervention, and housing, and who builds the houses and retrofits the houses, which is a whole different thing, and they're very intractable.
Yes, I want to touch upon the comment on migrant workers. There is also, I think that we should somehow address this in our recommendations or key gaps. There's major issues. We're now running a big analysis on these workers in Europe, and so there's also cultural issues related to it. They wear completely different clothing compared to the native population, and they have other customs. They're completely different, but they work in the same environment as the indigenous people. So, and as far as I know, there's any research done on that from a heat point of view. So it's definitely something that we should somehow add to our recommendations.
Sorry, I'm just going to go.
Thanks. Elspeth Opperman from the Technical University of Munich. Just,
Speak up, please.
can you hear me now? Elspeth Opperman from the Technical University of Munich. In relation to that last point, there is some research on those kinds of questions, but we can talk about that later. I just want to echo something that Ollie mentioned very briefly, and which I think should be a key message, which is the real need for multidisciplinary approaches, because what we've seen today sort of surfacing has been a lot of sort of misconceptions or sort of translation gaps between the different disciplines, and I think that for GIN as a network, it's also a really sort of crucial practice and challenge for us to consider going forward.
Okay. Yeah, I had to have a point. There's interesting interactions between the physiologists and the epidemiologists, which we've captured. Okay, so it's Lars, and then there was someone.
Yeah, mine was back to the use of AC. I think it would be extremely unwise to say that we should avoid total use of it. I think that Ollie's input is that we, by smart using of other technologies, maybe combined with that, or because we shouldn't just look at the same, as Julie said in the beginning, quoting Einstein, problems that creates aggravates the problem. So of course we should look at better ways of cooling our buildings so that we can, maybe in combination with ventilation or increased airflow. I mean, but a smart way to use air conditioning is just lower the temperature to 34 degrees. Then you are below the any doubt you will benefit from the air convection, both by dry and wet heat loss mechanisms. So again, I mean, and I perfectly agree that of course we should be able to explain this based on whether it's epidemiology or physiology or communication so that it can be used. But I think that if we do the other thing, then we will make a mistake because, as you said, it's extremely important to be able to get nocturnal cooling and to be able to rest from the heat exposure.
Lars, yes, sorry.
I take the opportunity to ask one question concerning the physiologists here within the audience, because it is so important to speak on one side about technology, facilities and measures, but on the other hand also to strengthen the capacity and capability of human beings, which means are you able to give a personal health adaptation capacity advice to the people, which we can do as guidance for the public in our societies. I think this is a matter of perhaps fitness, or you mentioned this point. Are there some kind of general recommendations out of the latest study results? I think this is so important too.
Yeah, thank you. So we'll have that as a
Quick, 3
potential
points.
pilot project, right?
2 points which are connected, which was we didn't hear much on urban heat islands. So what is the met temperature versus the city temperature? Second related point is what is the temperature in the houses, and especially houses of the poor which are made with tin roofs versus the old houses which may be even cooler. Third related point, and I didn't hear much, is what we are seeing in Ahmedabad is lack of nighttime cooling. It is not the maximum temperature, but lack of nighttime cooling is much more causing mortality. That was the third point. So something on the minimum temperatures going up. The fourth and last point was we didn't hear anything on mortality of newborns, because hypothermia leading to newborn death is well known, but hyperthermia in the heat waves, we have some documentation from the but leading to increased mortality also need to be looked at.
Okay, yeah, no, I have got those. I mean, I think it's interesting that there are very few kind of housing related people here, but I do know at least 3 projects of indoor temperature measurements in poor urban houses. So they should report quite soon. But I think there's a need to have a depository or a link, maybe. Okay, I'm going to use the floor now. Okay, Virginia, and then you.
A fascinating session. I think the one thing that we're really missing is how we get heat waves onto the policy agenda. And I think this is something that worries me, and what we need to try and do is make sure that we define heat waves and the actions in a disaster risk reduction way so we can use the Sendai framework to support all this work. And I think that's a really important action.
Thank you.
Based on our talk so far today, I think there may be a bigger gap in occupational, specifically with the tourist industry. Being from Florida, I'm surrounded by theme parks, and also Florida, it's hot. And I don't know of any data, or if maybe Andres might know anything about how heat is affecting those workers that are outside for 8 to 15 hours based on, work that I've seen locally.
Okay.
I'm building on what she said earlier about lack of focus on the vulnerability groups. We speak about pregnant women, we speak about young, older, but working population are again very vulnerable to heat stress. They have 2 things to deal with. One is the metabolic workload, and another thing is the environmental heat stress as well. So we have data on outdoor workers, indoor workers across the world now. We do have data on this. It's just that, what is the threshold for them? We have the thresholds done for the Marines in the US who are very different from what the workers are. So we need to start building threshold levels for different countries, different ethnicities, and that's very important. And also using all this technology, including the fan and everything, using traditional technology to actually protect the people, which is doable and which is feasible, rather than trying to tell air conditioning is good or. Yeah.
Both a research and an operational.
Yeah.
Okay.
And then building upon that policy.
Were there some in the back? Anyone who hasn't spoken yet? Tom. Oops, sorry.
Adding on the point of people of vulnerability, I think we didn't touch on people with disabilities. So they have very different needs from even the vulnerable groups that we have mentioned. So, and also the people around them, how do the people taking action to giving assistance or giving support to them.
Good point. Okay, and then. So I think maybe take a couple more on kind of evidence gaps, and then we'll just, for the last 10 minutes, we'll focus on the networking.
I'm Sujud from the Ministry of Health, Saudi Arabia. Actually, our background is a little bit different. I work in mass gathering center, and we provide evidence for related to Hajj, the pilgrimage to Mecca. Now, if I want to, I was wondering in the relation, how can we provide evidence-based heat health policy in relation to air conditioning in the housing. We provide housing, residential areas, or in campsites, in the ritual sites inside Mecca. And it's well air conditioned inside though. If they will have to do the rituals, they will have to go outside. Outside is non-air conditioned areas, So most of them, they will be 1/3 of Hajj population is above 60 years old. They have comorbidities. Beside, most of them, they come non-acclimatized. They come in a short time period. So it's a little bit confusing. Shall we continue provide them with the air-conditioned areas, or provide areas with fans? Future plans, we have that we will provide shelters or sheds and showers, and not showers, or we have sprinklers all the way in the outside ritual areas, but it's a bit confusing, like which one we have to maintain, which one we have to provide in the future.
I don't think we can answer that now. It sounds quite a complex population with a very complex event. So maybe you convene an expert panel and get some of these physiologists down there. Right, and is this the final research question?
Yes.
With the mic.
Yeah, I can talk loud. So kind of going back to the AC, something that just kind of popped in my head is the use of AC and fans going to actually be more detrimental to the warming that's happening outside versus the health benefits of being cooled down?
Yes is the answer.
Sorry, can you repeat that again?
So
Is the use of AC units and fans, the energy that they're producing, going to then accelerate the warming that's happening outside and be more detrimental versus the cooling down that it's benefiting an individual?
From an AC perspective.
yeah, so indoors fine, outdoors gets a lot
Yeah.
hotter. Yeah, that's the problem. Okay. Are these it's we've got 2 minutes before lunch. Is this about the networking? Does anyone have any urgent networking needs they would like to share? Yes. Is that all right? And then, sorry, we have to do our duty.
Hi everyone, Dave Hundula from the US. Thanks, I've really enjoyed all of the nice presentations today. I think a possible activity for the network is the idea of a repository that Shari was mentioning. I'm thinking specifically about the social survey type of research that has been done. As best as I can tell, browsing the internet, there's not a good central repository for this community. In fact, on the NIH disaster resource webpage in the US, if one searches for survey resources related to temperature, you get a sorry message with a little frowning face. So I think when we're thinking about what might be in the repository, survey instruments and items and the extent to which they've been validated could be quite useful. And I'm not sure if the thermal physiologists would similarly be interested in uploading protocol and so on as well. But I think we have a real opportunity for alignment there.
Great. Any more for?
Quick point, I think epidemiological methods for data sparse areas, I think need to be thought through. And second one, quick comment between all the three. I think there's mention of AC and mention of fan, but there is very popular and cheap thing called evaporative coolers, which are water-based coolers which work very well in very dry weathers and which is almost a little bit more than fan consumption. I think we have to also think of that. Many parts are quite dry, and I think Mecca may be the right place to try it out.
You're speaking in terms of future of Gen and networking, and I'm thinking that there are large indigenous populations. I know in the U.S. I work with tribal communities throughout North Carolina. They're a completely different set of criteria. Lots of knowledge we can learn from those communities, and perhaps somehow thinking more about integrating tribal communities into this conversation.
Okay, good. Any more for specific needs? Okay, this and then.
I'm wondering if maybe having regional in-between forum meetings, because our needs are so vast for the different areas, Even within the US, there's every climate possible. So having some smaller meetings before the next forum might be more beneficial so that we can then come back with better policies and ideas.
Yeah, I'm sure NOAA would fund them.
So I think it's really great that Jen is doing. There's a lot of health and architecture, but I think urban planning is also very important because for us in housing who use air conditioning, we mostly when we come back from work and we have it on during the night. But it's the malls, it's the schools that use air conditioning for over 18 hours a day. Like how do we get them to control the air conditioning temperature? Because we have done focus groups where people are saying it gets less hot during the night because that's when the malls start closing down and the heat from the air conditioning exhaust unit doesn't flow into the housing. So how do you deal with all that issue with urban planning?
Yeah, hospitals around 24/7. Okay, right, one at the back.
Hello, I'm working for the Red Cross. I think for the future of Gini will be interesting as well to extend the network to INGO and to any humanitarian sectors because humanitarian INGO have great interest in working on heatwave. They are willing to learn and they have already some experience in doing something, despite the fact that we have still a lot of gaps in knowledge and practice. So I think it could be interesting to invite more INGO for the next forum.
Right, okay, we'll just take these two final.
Speaking of INGO, I'm from Greenpeace. I'm Walton, the energy campaigner in Hong Kong. So I think I want to point out that, yeah, definitely a good idea to engage INGOs because we have the capacity, we have the network, and we are actually, Greenpeace is trying to juggle between mitigation and adaptation. So that's why I'm here. We are very new to this topic, so very glad to be here. Thank you all for your presentation. The second main body we should engage is definitely the government. So in terms of lobbying and doing policy in Hong Kong, it's really hard. I'm sure many of my Hong Kong colleagues or researchers would agree on that, or maybe others will agree as well. So I wonder how we can have a very fruitful, maybe we have this kind of discussions between campaigners like me or researchers or professionals, and then how can we convey the message or maybe invite them for some very key point stakeholder workshop, something like that. So yeah, that's going to be my suggestion. Thanks.
Candy from Hong Kong Red Cross. First of all, thank you very much for that forum and a lot of good presentations in which help us to have a better idea how to enhance our services, especially related to this heat wave. I have one suggestion for the future networking. It will be nice if there is some kind of a sharing corner in which not only the research but also the practical experience. For example, when even in the key message, consideration may be put to see whether we can identify some key groups or priority groups in which we have to take care of. For example, elderly people, a lot of research so that they are much more vulnerable. And the other one, which I hear, is about the people who are living in tiny living space. I think that the condition may be more critical, so the key message can consider whether there is some priority group there, and then for the connection to have some sort of corner to put not only the research but the practical experience so that we can share. Okay, thank you.
Okay, I think we'll close it there. Thank you all very much. That's been extremely useful. So thank our speakers. So we're going to distill all that down, and we'll present it again tomorrow at the end of the day. So I've only got 5 minutes. So, but I'll see if I can post it on the website or something, so at least you can see it fairly quickly. So there will be a longer kind of discussion document. So Enjoy your lunch.